On television. We're going to go straight to the interview. I've still got Ivy Brenda Chirotich, former Miss Tourism Kericho here, and patient number 001 declared negative today. And right next to her on the other screen is Dr. Lois Ombajo, infectious disease specialist at the University of Nairobi and head of infectious disease unit at the Kenyatta National Hospital. Dr. Ombajo, good to see you. Thanks so much for your time. Let me ask you real quick, at what point did you declare Ivy Brenda negative?
Thanks, Jeff. So by the time we declare someone negative, usually we'll have had multiple results that are negative. So we take a sample for the lab. First time it's negative. After 24 hours, we take another sample, and if that's also negative, then we can declare that someone is negative.
And the time period, because we're usually being told quarantine is 14 days, but this took what, a lot longer, another week longer, right? How come?
It took longer because what we did is once someone is admitted, we take a sample just before the 2 weeks, and if that is positive, then we give it a few more days before we take another 2 samples. So it was positive a little longer than we'd expected, so we had to wait and repeat it again on 2 different occasions.
Let me ask you real quick, Dr. Ari, are there any follow-up visits or treatments for Ivy and folks who have turned negative in the end? Any follow-ups?
So at this point, what we'd be asking them is once they go home, they stay at home like the rest of the Kenyans should. They will monitor themselves, and if they have any concerns, they will let us know. So if anything else happens, then we'd ask them to come back. But if nothing else happens, we'll ask them to continue staying at home, just like everybody else should be staying at home.
So are you saying she could get it again if she's in contact with someone who has COVID-19? Could it reoccur?
So that's a question that we are all asking ourselves. And we sort of learn from what other people have experienced. And looking at other countries' experiences, there have been a few reports of people who've been negative and later came back positive. They're few, rare, but we know that those reports exist. For that reason, even if someone has been discharged, we say, you know, you may still be at risk. Many times we expect that if you've recovered from a viral infection, you may have some immunity, which means you may not get the infection again. But since this is a new disease and we're still learning about it, we still ask everyone to keep being careful, avoid any sick contact, stay at home and maintain this physical distance that you're talking about, as well as keep maintaining the hygiene measures. Okay,
let me ask Ivy Brenda this question while you're here, Dr. Ari. Ivy, real quick, how were you treated at Mbagathi? The doctors listening to you, how were you treated?
At Mbagathi, that's when I first reported it. The nurses took me very seriously, and they immediately took my temperature. My temperature was okay. So then they decided, you know, let's still go ahead and we'll test you and we'll take the other swabs. So they called an ambulance, and at KNH, the doctors were really nice, very supportive. In fact, I would like to thank the nurses and the doctors. These people, they put their lives, you know, at risk to make sure that I was comfortable, to make sure that I was, you know, doing well. And they assured me that they would walk me through the whole journey. So I'd just like to really thank them and thank the people who were cleaning my room as well, because they were also really nice and very supportive.
Yeah, I'm going to ask the doctor the same question in a little while, Ivy, but let me ask you this. People outside, I mean, obviously when you got to your apartment, the guard was a little fearful. Yeah. How are other people treating you right now? Are people a little scared to come close to you?
No, right now they're not scared because they saw me coming in and they saw me waving to my friends, and you know, they saw me getting in, and they were, you know, when you see someone is fine and she's doing okay, that's when you get a little confident. And they had already seen me and my story on the media. By the time I was actually coming for this interview, I said hi to the person who was at the security, and he was very excited. He said, yeah, I'm so happy for you that you're now good, and he was very friendly.
Excellent. Dr. Ombajo, over to you. How should regular folks treat people who have tested negative, who have come out, you know, with a clean bill of health? How should they be treated?
So maybe first, before I answer that, Brenda, thank you for that boost in the arm for all healthcare workers. You know, people are really giving their best shot, and it helps when people appreciate what healthcare workers are doing. So once someone leaves, I think this is a time when we're all trying to do the same thing. We're all trying to stay at home. But what's important is that we don't stigmatize people, because as you've seen over the last few weeks in all news all over the world, this is a disease that can strike anyone. It's not a respecter of age or race or social status or anything like that. So we're all at risk. Let's support those who have disease. Let us not stigmatize one another. If someone is unwell, encourage them to call so that they can be directed to the right place. If someone gets better, allow them to integrate with the family and keep supporting them. So let's say no to stigma at all costs.
Well put, Doctor, well put. Okay, look, for the first time today, we saw the numbers jump to double digits. Is that surprising? Were you expecting that?
So I wouldn't say we were expecting. I guess every day we wake up hoping that we don't have new cases. So every time we have new cases, it's disappointing. What we know about the new cases is that there are people who have been in quarantine. So these are all people who'd traveled into the country recently. So they may have been exposed from, you know, whichever countries they came in or during travel into the country. So I guess in a way, we're glad that it's not so much out in the community, but still it's always disappointing when we find new cases.
Yeah. Look, the numbers have been rising steadily, Doctor. Are you fearing the worst in the coming days?
We hope for the best, but we keep planning for the worst. I think we watch other countries and how they've had to go through, you know, very difficult times. And we know that we are at risk of going through such difficult times. And I think that's why all these measures of reducing movement, or, you know, being asked to stay at home have been put in. Because the only way we are going to win this battle is if we keep away from crowds, if we stay home, and if we do all those things that we are constantly talking about.
Most of these tests that are coming back positive, Doctor, are they from returnees, or are you seeing more and more what you call community transmission?
So most of the tests that have been positive have been from returnees who are in quarantine. I think, for example, the cases that were announced today were from people who recently returned into the country.
And most of these cases are in isolation centers. Is that what it is? Is it a concern?
Yes, most of them are in quarantines. Yes. Most of them are in quarantine centers. So they came back into the country, and the government had put in place what we call the mandatory quarantine. So everybody was sent to one quarantine facility or another. And most people have now been in quarantine for just over 7 days. And I think there was a move to test everybody who had come in and was in quarantine. So that's how many of these positive tests have been picked up.
All right, stand by, Doctor. Let me come back to Ivy Brenda. Ivy Brenda, real quick. We've been hearing stories about ventilators and things like that. Did you have to endure that?
No, I did not have to go to have any kind of support in order to breathe. I was just breathing fine. Just a few chest pains at the beginning, maybe the first 5 days, and that was it.
Doctor, let me come back to you, because Ivy mentioned a moment ago that you have been consulting with the Chinese, and she got some antibiotics and she got some drugs to take during her 23-day quarantine. What are you prescribing? Take us through that with the patients who are under quarantine.
So for most of the patients, so there are two things, Jeff. There's quarantine and isolation. So quarantine are for those who have not had any symptoms, so they may have been in contact or traveled back. So, and then isolation is for someone who's been found to have the coronavirus. So then we put them in isolation. So for most of the patients who have the coronavirus, most of the patients we've had have had very mild disease. They probably had a cough, maybe a bit of a sore throat and fever. Only a few patients have had severe disease requiring ventilation or help to breathe. So for most of the ones who've had mild disease, they really don't need much treatment. Most of the treatment is symptomatic. So they'll get something to reduce the fever. They may get what we call an antihistamine to reduce the congestion in the nose. And it's really just relieving the symptoms. If someone comes with very severe disease, so they have a severe pneumonia, then they may get some antibiotics at that point. Then a few have required to use a ventilator.
Okay, look, I've been talking to a lot of my friends who say they have 3, 4, 5 more days until they are out of mandatory quarantine. Are you worried, or is this coming week, is that the critical week for this country? Or what are we looking, next 7, 10 days, 2 weeks?
So for those who are in quarantine, if they've been in quarantine for 14 days and they've tested negative, they'll be released from quarantine to go home. Even after release from quarantine, they'll still be asked to stay at home. And the reason we're asking them to stay at home is, one, to protect them, because if you're going out, you may meet other people who may have the virus, but also in the rare chance that you may have got something, by staying home, you're also protecting your loved ones and other people. So in terms of, is it a critical moment? We really can't tell. What we know is that the more cases you have, the more contacts you have, and the higher the chance that you pick more cases. And that was the reason for asking people to be in quarantine and for keeping people in isolation and for asking the rest to stay at home.
Which brings me to my next question, Dr. Ari. You know, we've been hearing this phrase, flatten the curve. What do we need to do going forward to flatten that curve?
So flattening the curve for us would mean, if you remember a few days ago, there was a press release that said, you know, if things go as they are without us putting any interventions, we may end up with about 5,000 cases or maybe 10,000 by the end of April or May. So flattening the curve means we reduce that peak. You know, that peak of cases comes lower so that instead of 10,000, you have 1,000 or less perhaps, or even much less than that. And what we need to do to turn that curve, one, is to stay home. Because the fewer people come into contact with each other, the less we can transmit the virus to one another. So that staying at home is so important. Two is to continue observing some of these hygiene measures. You know, frequent hand washing, avoiding physical contact with one another. If you're coughing or if you're sick, really stay at home. If you're sneezing, coughing, wear masks so that you're not spreading droplets to other people. So we really, really need to make sure we do those things over the next few weeks.
All right. Dr. Lois Ombajo, thanks so much for your time. I appreciate it. She's an infectious disease expert at the University of Nairobi and head of infectious diseases at the Kenyatta National Hospital. Thanks a lot, Doctor, for your time, and good luck. Ivy, I'm not done with you yet. Real quick. There's some Facebook and other accounts that have been opened in your names talking about all kinds of things. What do you have to say?
I'd just like to tell them that they should be careful about the information they get from social media pages, because they may be inaccurate information being shared from sources that are not verified or credible. So my Twitter account is, my username is IV_B_Cherotich. I've been told that there's a media account that's been created that's spreading news about there being a treatment for this virus, but it's not a medical expert's opinion. So I think we should follow the guidelines that have been provided by our doctors, MOH.
Yeah. I can't believe a young, eloquent woman like you doesn't have a job, Ivy. How come?
I'm not so sure, Jeff, but I did electrical and I can work in the electrical and telecommunication engineering sector, so I'm still looking for a job.
And what did you want to be when you grew up?
I always wanted to be an electrical engineer in the industry, or in just for NASA I could, but for the industry, power and energy would be nice. All
right, so when the cameras and the lights are off your face and off of you in the next few days, what are you going to do, Ivy Brenda?
For the next few days, I have to stay at home. Because, you know, I have to be careful also. I'm following the guidelines provided by the medical experts, and that's what they say.
And what do you tell your generations, a lot of whom don't think that this COVID-19 is real, that it's out there, it's not going to reach them? What do you tell them?
You know, I would understand why they would say that, but then again, you have to be realistic. This thing is coming and it's going to spread if we do not follow the guidelines. It's best now for people who've seen me and people who know me, at least they know this is real. That's the whole point of coming out, for people to know it's real and for them to be careful and not spread it to other people.
All right.
Yeah.
You get the final word going forward. Ivy Brenda Cherotich, what do you say?
I would like first to say that I really thank God for what He has done for me, that I am a living miracle, that this is treatable and it's manageable, and I would like to urge people, you know, to be responsible and to be each other's caretaker. If you are feeling any symptoms, just, you know, quarantine yourself, and you can even reach out to the ministry through their number 719. And contact them, let them know how you're feeling, and also, you know, don't create panic and fear and spread false information. Always follow the guidelines that's been provided by the doctors and the ministry.
Yeah, you become a great ambassador for MOH. Thanks so much, Ivy Brenda Cherotich. And of course, Dr. Lois Achieng Ombajo, infectious disease expert at the University of Nairobi and head of the infectious disease unit at the Kenyatta National Hospital. Thank you both, ladies, and all the very best to you. Good luck.